Greetings once again. It's a pleasure to be back and it's a pleasure to be having this conversation with you. So, last week we had an announcement actually that came through the Gazette notice by the Ministry of Health. And this Gazette notice indicated that now we have mandatory travel health insurance in Kenya. With this provision coming into perspective, one of the key things that I've been seeing in the different groups and the different forums that I'm part of is that people are asking, what does this mean for me? What does it mean for the people who are planning to travel into the country? What does it mean to the travel industry, especially with tourism being one of the greatest economic drivers and enablers for this country of us, Kenya? On a healthcare perspective, what does it imply for all of us in terms of the conversation that we need to be having? And that's an important question to ask, and is also an important piece to understand where does this come from. And in this particular video, my context and the key journey that I'm going to walk with you is seeing where does this start, where does it end, what are the facts, what are the opinions, but also what is the way forward depending on where you're coming in from. And I'm hoping this information becomes enlightening, valuable for you, but also kind of shaping where things should be for us as a country and for us as a people. So first things first, the mandatory travel health insurance is provided for in law. When we have the Social Health Insurance Act passed in 2023, this was one of the clauses that were there in Section 26, Part 6 of the law. So then it is in law, it should have happened from 2023 when the new Health Act was passed, that is the Social Health Insurance Act. It's just that it hasn't been implemented since then to this particular moment. The second piece that comes into perspective is acts of parliament are operationalized through regulations. And when you have the social health insurance regulation, and segment of it actually mentions specifically that there will be regulations and it will be mandatory for everybody entering into the borders of Kenya, whether Kenyan or non-Kenyan, coming for travel purposes will be mandated to have a travel health insurance at the point of coming into the country, which means you either are permitted to buy it before you travel into the country, or if not, you're able to buy it at the port of entry, whether you're coming in either through the airports, through the road gateways and everything, the border post and all that. You must have it into as you're coming in. So it has been there from 2023. The regulations came into place subsequently after. And then what happened last week on 30th of July is that the Gazette notice was published indicating that everybody getting into the country will now be required to comply with this provision as per the law. The areas where we have kind of variances in terms of what people are perceiving it to be and what people are not clear about is the initial quoted figures as per the schedule, and actually I'm reading on it, is that the maximum benefit limit is 50,000 US dollars. That is the benefit. If, for example, today David is getting into the country as a tourist, then I'm required to have a medical travel health insurance. Then, if I fall ill, the limit to which I can get medical services, whether it's just treatment, eye care, mental health support, I die and my body has to be repatriated to another country depending on wherever I'm coming from, the total package cost is costed at 50,000 USD. And then ultimately, when you break it down into the specific unit item that were provided for, the medical expenses, if I'm sick and being treated in the hospital, all the other costs will be up to 20,000 US dollars. We have 25,000 US dollars for emergency medical transportation. If I'm going to be flown away, travel using these, whatever I call the ambulances and all that, medical emergency transportation is 25,000 US dollars. Prescribed medicines up to 300 US dollars. Mental illness, in case I'm having mental health problems, that would be costed at 1,000 US dollars. Repatriation of the mortal remains. If somebody gets to die when they're on trip and tour in Kenya, the cost of that transportation back to their countries will be catered for under the insurance up to a tune of 5,000 US dollars. That is the provision of the act. These figures, and the reason as why I read those figures is because these are not the costs that you are expected to pay as a person traveling into the country. The estimated cost as at now is around 44 US dollars for everybody getting into the country. It is a flat rate from what the discussion in the different forums has been, which means it will be around 5,000, 6,000 Kenya shillings maximum or thereabout as per the current rates that are being mentioned. But it is not the mandate of the government to set the price. And it is also important for us to understand that the travel health insurance is not being issued by the government. It is not issued by the Social Health Insurance Authority, the Social Health Authority SHA. Reason being, when you look at the regulations, that is Article 7 of that particular segment, Section 70, Part 2B of the Health Act indicates that we must have it. But then Part 7 is specifically indicating that these insurance shall not be offered by the Social Health Authority, which means the social travel insurance mechanism in this case will be through private insurance companies, and it is upon them to determine what rates are they going to put in place, how will that actually de-risk them as an operational level, but also be affordable to the consumers and the public who are going to be affected by this. What is the situation as it is now in the country? The Consumer Federation of Kenya has actually gone to court to try to stop the implementation of this requirement and this Gazette notice. I don't think they're going to make much headway, because if they're talking about not having been engaged, the Social Health Act has been in place from 2023. It was already in place. So what makes it mean that they're not consulted? Because at that particular moment, there was public participation in the act. People engaged, whether people are happy with the outcome or not, it was passed, and it actually has been a law in the country for the last 3 years. Subsequently, regulations were passed, which still continued. It's indicating the specific requirements of what needed to be there. So that is already in place. What could be questioned here would be, how did we arrive to these numbers? And I think that is now a benefit package conversation on where saying, how did this come into place? What needs to move forward into the next frontier? That is a very fundamental conversation to have, and that would be it. In terms of the cost factor, when you look at the $44, which is being indicated, 5,000, 6,000 as medical cover, from most of the people who are talking about it, relatively I would say it would be higher. And the reason as why I look at it as a higher figure is because when you look at most of the global markets and the European markets, the Schengen region, when you have, for example, CoverWise, and I looked at one of my travel insurances, I paid for 3.87 pounds for a 1 week tourist visa from the UK to Denmark for that period. Therefore, then it means I was being charged around £1 per day, and that covered some of the risks in terms of my travel in case I was to lose my luggage up to £200 and all that. That is the operational bandwidth. So the question is, are we going to set a flat rate, and what is the rationale? And if we are going to have a variable figure, what is the daily rate and what is the scope of that cover? I think the private insurance will be able to define what the policy instrument would look like in terms of the cover. But then when they do that, it is imperative for the consumers now to come in and say, what is the justification for those figures that are going to be proposed? Our neighbor in Zanzibar, that is the Zanzibar Island in Tanzania, already have the mandatory travel insurance that came into effect in 2024. It is being implemented. Anybody traveling into the country is now required to have the mandatory insurance cover. $44 for adults, $22 for children. Anybody less than 2 years does not need the medical cover as per the provision that they have in Zanzibar. Kenya is adopting the same. What is the genesis of this? I would say generally from a corporate standpoint, these people are looking for business, and therefore then it is justifiable to protect people and get that business from an insurance standpoint. For the public, we have situations where people travel into the country, they fall ill, and their medical cover cannot take effect because the jurisdiction, for example, if I have my medical cover in Kenya with UAP, for example, my cover will protect me in Kenya and the East Africa region. In case I travel to South Africa or out of the continent, what takes care of my medical needs in case I'm there and I fall ill? Those are some of the considerations that we need to ask ourselves. As a patient, as a person, this is in your benefit to actually have a medical cover that will take care of your medical needs when they arise outside of where you are domiciled generally, naturally, in every other moment. The question is, how much are we willing to pay, and how is this going to be implemented? That is a conversation we need to look at and need to have. And that is fundamental. So moving forward, what do I see this coming into? Ultimately, because it has been in law from 2023, the regulations have been there, it is going to happen. The question is, how does it happen? And I think that is now the dynamics operational nuances. And then the other question that would come in is, if you're talking about this as a provision within the social health insurance scheme, would it be advisable to amend it to ensure that these also become a cover scheme within the social health insurance mechanism in the country? Or why do we have to limit it for private sector players? That is a conversation to think about. Then for the insurance companies, ultimately when you're underwriting any risks, those risks need to be borne by somebody. The volume of clients that are traveling into the country will ultimately impact or contribute to how much the margins can be lowered or can be increased when somebody's talking about from a cost standpoint. So the question is, will we be opening up our insurance and especially medical insurance market to global players who have been having very competitive and lower rates, or will we stay grounded and actually fixed with the current insurance players that we have in our markets who are actually underwriting such kind of risks? That has become a game that actually people need to understand. I know we have some global players in the market. Either they'll get in and outcompete the other smaller players, or they'll actually agree on working on a standard framework that would be adopted by everybody else. It might, if it gets to the point of negotiations, that is collusion, competition laws might come into play, and something will need to change. But the general principle of it is the figures that were there are not what is going to be paid for by people. The tentative average figure is $44, 5,000 to 6,000 shillings. The law is already in place. Public participation has been there. If that is the question that the COFEC team are asking, then moving forward, how do we implement it and how do we move forward? It is for the good of the country, for the good of the people who are going to participate in this, but also for the good of the patient who is being protected and being covered in their medical needs when and where they need it. So it's a matter of wait and see, but most importantly, pragmatically plan for what you envision for your medical and travel insurance cover. If you enjoy the conversation, I would encourage you to subscribe to the channel, ask me those questions that you're thinking, probably something that I've not covered, and let's engage. Let's build a conscious community, but also a movement of people who understand better how we need to move forward in the future that we aspire for. Thank you and have a good one.